Femoral nailing restores stability after high-impact injury. Often needed following road traffic trauma, falls, or violent twisting forces. Fixation of lower subtrochanteric fractures, proximal femoral shaft fractures. Temporary stabilization of fractures of the femoral shaft. Pathological fractures requiring intramedullary stabilization. Revision cases after failed plate or screw fixation. Precision, strength, reliability. Jin-type femur nailing system. Diameter: 9 mm to 13 mm, 1 mm increments. Length: 320 mm to 440 mm, 20 mm increments. Available in stainless steel and titanium. Designed for the treatment of femoral shaft fractures. Cannulated intramedullary nail ensures accurate alignment and stable fixation. Supported by a comprehensive instrument set for precise insertion, secure interlocking, and safe removal. The patient is placed supine, and gentle traction is applied to the fractured limb for alignment. Radiographic ruler is used to determine the suitable nail size and diameter. A 3.2 mm guide wire is introduced to form the pilot hole at the canal center. Its trajectory is verified under AP and lateral fluoroscopy. The cannulated awl is used over the 3.2 mm guide wire to establish the entry hole. Alternatively, the cannulated headed reamer with protection sleeve can be used for entry creation. The opening is confirmed, and the reamer is withdrawn. The 3.2 mm guide wire is replaced with a 2.5/3.5 mm guide wire with ball tip using a reduction device. The guide wire with ball tip safely navigates the canal for reaming. The canal is prepared with a flexible reamer shaft and a reamer head to smoothen the pathway for the nail. The reamer head is kept slightly larger, 0.5–1.5 mm, than the selected nail diameter. After securing the canal, the flexible reamer shaft is withdrawn. Using the plastic exchange tube, switch from guide wire with ball tip to 2.5 mm guide wire without ball tip. The Jin-type cannulated nail is attached to the insertion handle with a nail-holding bolt. The nail is secured to the handle using a 5 mm hex Allen key. The assembled nail is inserted over the 2.5 mm guide wire. The 9.9 mm impactor and extraction rod with ram are attached, and the nail is seated with gentle hammer blows. After seating, the impactor and guide wire are removed. The proximal targeting device is fixed to the insertion handle using its locking bolt for proximal targeting device. Insert the 10/8.2 mm protection sleeve with 8 mm trocar through the proximal targeting device to mark the placement for the proximal bolt at the dynamic hole of the nail. Remove trocar and place a 4 mm drill sleeve in the protection sleeve. Use 4 mm drill bit plane shank/Jacob chuck end to create a bicortical hole through the femur. Remove the drill bit and drill sleeve, then measure the depth using the depth gauge measuring up to 90 mm. With the depth gauge tip on the medial cortex, determine the correct 4.5 mm locking bolt size. Insert the measured 4.5 mm locking bolt using the 3.5 mm hex T-handle screwdriver into the pre-drilled hole. After securing the bolt, remove the T-handle screwdriver. After proximal fixation, attach the distal targeting device to the proximal targeting device using designated bolts for distal targeting device. Ensure markings align with the selected nail length. Connect and tighten distal targeting arm to the distal targeting device using bolt for distal targeting device. Place 10/8.2 mm protection sleeve with 5.2 mm drill sleeve in the distal targeting arm. Create a unicortical hole using 5.2 mm drill bit plain shank/Jacob chuck end. Remove the 5.2 mm drill bit and use a 5.2 mm T-handle drill bit with flat end through the sleeve to clear debris. Once clear, remove the T-handle drill bit. Insert 5 mm positioning rod through the protection sleeve. Secure positioning rod with positioning block on distal targeting arm. After fixing the nail, use the 10/8.2 mm protection sleeve with 8 mm trocar to mark distal bolt insertion point. Repeat proximal procedure to fix 2 distal 4.5 mm locking bolts. Remove the positioning block and retract the positioning rod. Unscrew and remove distal targeting arm and distal targeting device from proximal targeting device. After distal fixation, reconnect the 9.9 mm impactor and extraction rod with ram to the insertion handle. Tap the hammer on the extraction rod away from the body to reduce the fracture. Place the protection sleeve at the proximal static hole and repeat the drilling and measuring procedure. Insert final 4.5 mm locking bolt. Unscrew nail holding bolt to detach Jin-type nail from insertion handle. Screw in the appropriate end cap corresponding to the selected nail size. Femoral fracture fixation with Oxion's Jin-type nailing system is complete. Begin gentle limb movement as per surgeon's advice to prevent stiffness and improve circulation. Progress from partial to full weight bearing gradually, guided by radiographic evidence of healing. Use prescribed analgesics, apply cold compression, and elevate the limb as recommended. Engage in regular physiotherapy sessions to restore joint motion and strengthen surrounding muscles. Attend scheduled X-ray and clinical assessments to monitor alignment and nail stability.